Hi everyone, Sandy here again with our Health Tracks at Home. Today we're going to continue talking about being our own health advocate from a little different side. You know, life used to be so simple. We could have a consultation with the doctor, we get all the information we need, we go into the hospital, we plan, we schedule, our family comes in, they're our health advocates, they help us when we have surgery, and they take care of us when we come home. Well, now COVID has hit and that doesn't happen at all. No one gets to go into the hospital with you to hear what you're being told. You have to be your own health advocate in this time. So I've got some suggestions on how to do that with two different situations. And the best thing to do is be prepared. So that's why we're talking about that today. How do you prepare when you face these two situations? One, it's an emergency or it's urgent and you end up in the hospital after a procedure or after some kind of fallen or something like that. And the second situation is a scheduled surgery that you've been waiting for, an outpatient surgery or an inpatient surgery that you're finally getting scheduled. And how is that different now? It's very different. So unplanned situation, it's an emergency or it's urgent regarding something that has happened to you. We want you to be prepared. So I am going to be looking at my notes because I want to make sure that I cover all the things that I've written down because I think they're all important. So sorry for that. I can't remember them all in this old head of mine. So keep the following information in your wallet. If you haven't already done this, this is a good time during COVID to make this a habit. And you need to change this information every 6 months. Review it, make sure it's up to date, and put a new one back in your wallet every 6 months. Maybe when you change your smoke alarms, change your health information. So the first thing on this piece of paper is your health information. You want to have a list of all your current medications and your pharmacy number. Believe me, when you're under stress, trying to remember that isn't easy. A short synopsis of your health history. Everybody in the world is going to ask you that. Hopefully they have it in the computer, but as you know, they still ask you all the questions. Your insurance cards, we all know that. And your power of attorney for healthcare. Who's that person who is responsible to make those decisions for you if you can't for yourself? The next thing is to make a list of your emergency contacts. Who are the people that you want to get in touch with? Not the doctor, but you. Who do you need to talk to in case of an emergency? Who has the key to your house? You're going to write that down. What are all the numbers for all of your bills that you have upcoming? Your house payment, gas and electric, whatever you might have coming. Contact for who will take care of your house if you need the gas turned off, if you need the water turned off. Your apartment manager's number. Other physicians and their numbers. They always ask you about that, especially if you see doctors outside of your medical group or if you've had any testing outside your medical group. You want to have those numbers available for them in the hospital because they're going to need to track that. Then have a plan if you're unable to take care of yourself when you go home. Most of us don't even think about this. What if I break something and I live by myself? If you have a spouse, they're going to help you. But if you don't, or they might not be able to help you, depending on their health themselves. So have the numbers of friends that you can contact and call and have a plan for what's going to happen for the what ifs. If you break something especially, or if you're really weak after being really sick. Food delivery preparation, have that already set up. Who are you going to call? Who's going to take care of getting you groceries? How do you get your medications? Are you going to do a delivery or is somebody going to drop by and pick it up for you? Those are important things to have prepared and think about before you ever get in the situation. And ask questions at the hospital discharge. This is the only time that you get a nurse one-on-one to talk with you about all the details, and you're so out of it that you don't even hardly are able to ask questions. So take advantage of this situation, and I wanted to go over some things that you should ask. How will I control my pain? Who do I call if the pain is not controlled? Or if I have a reaction. Wound care, site care. How often do I do it? How do I get supplies? Very important. Take notes of the procedure if there is a wound care that you need to learn, or take a video of it because for your spouse that might be helping you, or a friend, and for you to remember. So it is really helpful if you take a video, if you can do that on your phone. If not, snapshots, or get detailed instructions on those discharge instructions from the nurse. And then who to call in case of an emergency, and what is an emergency regarding whatever happened to me. Who should I expect, or how long should I expect to recover, and what should I be expecting to recover? What is normal and what is not normal? Can I drive? That's important. And what do I do until I see the doctor? When do I see the doctor? And how often do I see the doctor? So then those are some little questions that you can write, and also they will give you an in-depth, according to whatever your situation is, discharge instructions. Ask them to make them specific to you, because they are general instructions and they may not apply to you. And I don't want you to be confused by the things on a piece of paper that do not apply to you. So ask what applies to you. So then there's the planned or scheduled surgeries or procedures resulting in a hospitalization. Sometimes we can go in for colonoscopy and end up in the hospital. I mean, there are procedures that you have to stay overnight as well. So again, be prepared. Have all those lists in your wallet, so all that information is already taken care of, so you don't have to worry about anything. Questions to ask the new doctor or surgeon. This is important. What should I expect after this operation or procedure? Get as much information as you can get at this visit. This is your time. Don't think about how many minutes you're spending with the doctor. This is when you get his full attention and you get the information that you need. Unfortunately, in this day and age, it may be when you are waiting to go in for your operation. So you want to make sure you get as much information when you're still with the program, so that you can find out what to expect. And take notes. Take lots of notes. Will there be bruising? Will there be swelling? Will there be redness? And how long will the pain last? And do I need to change my house to make it safe? How long will I be in the hospital? These are good questions to ask regarding a new procedure. Get directions for aftercare at that appointment before you go in. Talk to them about, am I going to have a dressing? And am I going to have to change it? Or how long is the dressing going to stay on? And when can I take it off and keep it off? If there's medications to apply to my wound, how do I do that? Do I use a Q-tip? Do I use my finger? And how often am I do that? And how long am I going to have to put that on? So those, and then can I drive? That's obviously we all know we're going to ask, when can I drive again? And that is at your appointment. You want to ask those questions and many, many, many more that you come up with yourself. So then ask questions again at your hospital discharge, because things may have changed. Write yourself notes. Ask the nurse to help you, because again, you're recovering from surgery or a procedure and you're not at your healthiest, and it's hard to remember and get details straight. I can't tell you how many phone calls I get after the fact that says, I don't remember what they said. And it says this on this paper and I don't know what that means on the paper. So this is, again, when you ask, how will I control my pain? Who do I call if it's not controlled? About your wound care. The doctor told me that I'm supposed to do this, this, and this. Is that still what I'm supposed to do? Take pictures. If it's different than what you were told originally, have them write you notes. Have them take care of that. The nurse is standing there. In case it's changed. Who do I call in case of an emergency, in case that changes? And what are the emergencies I am now looking at related to what actually happened with this surgery? What should I expect as I recover? Is there anything new? Do I need to know that there's anything new? Did a drain fail and I have more blood in my leg than I thought? And am I going to have more bruising? What is normal? What is not normal? That's going to decrease your anxiety. It really helps to know what is normal, because you get all kinds of weird aches and pains after surgery, and it is good to find out what to expect. It will help you a lot. And then again, ask again, when can I drive? They're going to say that's up to your surgeon. So hopefully you've asked the surgeon that before you leave the hospital, and you already know it's going to be at least 2 weeks if you're on medicine, if you're on pain medicine. And when do I see the doctor again? And how often am I going to see that doctor? And am I even going to see him? Or do I go to my primary care physician for my follow-up appointment? Those are things they should cover in your discharge instructions. Again, make sure that they make your discharge instructions specific to you, because they are going to give you pages related to your illness that are generic. That means general. So we want you to know specifically what you need to know for you alone. So ask a lot of questions. You know, the things that are important: medicines, wounds, activity, driving. Those are things that are very, very important. How do I get in contact with people? And they should circle those things on your paper and make it easier for you. And then after you're home from either kind of procedure, whether it's emergency procedure or you've come home from rehab or you've been in for a scheduled procedure, you need to get a hold of your doctor. Just as a reminder, remember when you call the doctor's office, you are talking to a non-medical person. Request to speak with the physician's medical assistant to give the details, and then give that person the details. If that person is not available, then remember, again, this is a non-medical person. Try to have your description short to the doctor. What do you want the doctor to know? I have a fever. I have redness. I am nauseated. I am bleeding. I have swelling that I think is abnormal. Something very specific and very short. And then request a call by the end of the day. Even if they promise you, request again. I expect a phone call by the end of the day. And if at 4 o'clock they have not called you, call back again. That's just good practice for you as your own health advocate. In this day and age, we know doctors forget, they get busy, calls get dropped, and you don't want your call to get dropped. Most healthcare systems do have after hours numbers, and you want to remember to call them because the nurses are very good about giving you information that you need, and they're always available for you. So make sure you have that number as well before you leave the hospital. I hope this helps a little bit in this world of uncertainty. Be prepared before an emergency happens. Have all that information that you think you're going to need. I don't expect you to carry your phone charger with you all the time, but it's not a bad idea. In this COVID environment, you never know what's going to happen to you. So have all those things written down. Somebody that can get the information for you if not. And may God bless you and keep you safe. I hope all of you do not have to face hospitalizations during this time, but I know that it is part of life that we have to have things done, joints replaced and things done. So be your own health advocate during this time of COVID, and I pray that God keeps you safe and blesses you with his loving care. God bless you. Bye-bye.